So we're here with two representatives from the Paho office. We have with us in-country specialist, Miss ANNEKE Wilson, and we have Paho technical advisor, Miss Sally Edwards. Now, Paho which is a Pan-American health organization, is the principal partner in the delivery of health care and services here in St. Vincent and the Grenadines. Recently, we were affected by a TROUGH system that created significant damage in 3 of our cemeteries here, namely London in Sandy Bay, Old Park Hill Cemetery and Rosebank. Now, our technical advisor, Miss Edwards, she visited 2 of these locations and was given information about the other. She will give us some information about what happened on ground. What was the report from your technical standpoint?
So first of all, I would like to commend the response of the environmental health team to deal with the issue so quickly. I visited, as you said, 2 of the 3 cemeteries, but I understand that some of the issues are the same in the 3rd cemetery as in the 2 I visited today, and that is that unfortunately some of the land was lost and human remains were lost to the river and the sea from the cemeteries. In addition, the banks remain, or the edge remains unstable, and so there are human remains that will need to be relocated. They're in a bit of a precarious position at the minute.
What does that mean for us?
There's a big need to work with the family members to ascertain what is their desire to happen. There is no infectious disease risk at all to the community, but there's a need to treat the human remains that can be moved with dignity and to try and establish some form of memorial or site for those human remains that were lost, for the family members to be able to visit, to be able to still have somewhere where they can deal with it, yes.
So psychosocial support becomes critical at this junction?
Psychosocial support is extremely critical at this junction, not only for the families of the human remains that were lost, but those that will have to be relocated, as well as everybody else in the cemetery and the community around at large. I know that there will be a lot of questions in the community about using the rivers, using the sea, but I would like to re-emphasize that there is no public health risk from eating the fish or from using the water there. The pathogens are not in the remains any longer, but there is a big traumatic element to the loss in these circumstances.
So there would be a greater concern if the bodies were more recent?
Not necessarily, because of the length of time usually between passing away and being buried. Pathogens die in the human body very quickly after a person passes away, and usually long before we bury them in our communities. Most pathogens die within 48 hours of somebody passing away. In addition, the embalming process will hasten the die-off of the pathogens. So the public health issue is not one of infectious diseases, it is one of psychological trauma.
Do we have the capacity to do the work that is needed to be done to get this done in a safe and I don't know how easy it would be way at all?
As that isn't necessarily a health issue,
right.
I am not sure.
It's more of a technical.
It's a technical from yes, but you have very good engineers here in country.
But it's still dead bodies, that would be.
But the dead body itself is not an infectious disease issue. It's a case of how you move it. There isn't a health issue from dealing with a dead body at this stage. There are no infectious pathogens still present, and so it's more a case of doing it in a dignified manner. Given the age, though, also of some of the remains, it is complicated from a dignified way because there are no longer the coffins in their entirety in the ground because of decomposition over time. So it will have to be looked at with the families and decided what is the best method to move the remains and the headstones.
Okay, so we'll talk to ANNEKE now. Paho is giving us some support. Can you tell us what type of support is being offered by Paho outside of obviously Sally being here to give us technical advice?
Okay, the Pan American Health Organization continues to provide technical cooperation to St. Vincent, and this TROUGH system is nothing in exception. What we have been doing, the ministry has asked for assistance in terms of generators and water tanks, and we are presently working on that. We also noted that there were some issues with the Smart Hospital in Georgetown. There was some leakage, and at present we have the Smart Hospital consultant who has visited the hospital, made recommendations, and we are presently addressing the leakage issue. Apart from that, we're going to be working with the Ministry of Health and the Environment to provide psychosocial support to the residents of the affected areas.
Okay, that sounds good, because coming out of Sally's report is that there is a great need and will continue to be a great need for the psychosocial aspect to be addressed in terms of the community and the family itself. How can, Sally, can you tell us how can the community help the ministry and Paho in this drive to get the support that is needed? You know, the ministry's standpoint always focuses, or we try to push our motto, or health is a shared responsibility, and while the ministry has an obligation to its citizens to provide them with the services and care that is needed, and obviously we're getting that support from Paho, how can the community help us in that process, in doing their part, in playing their part in the role of the shared responsibility in terms of making sure everybody is where they need to be and get that kind of psychosocial support.
So one strength of the community supporting each other is in exactly these circumstances, where with the loss of loved ones, or the re-loss of loved ones, I should say. And it's very important, especially at this time as we're coming up to Christmas, which is normally a very much a family time of year, and a time of year where we like to make our houses look nice and do the little bits and pieces that we've not been able to do during the year for either lack of money or lack of time. And we now have a community that doesn't have a house to go to, so the community needs to come together to support those people and support each other, for the people not only who've lost their houses but who've lost loved ones, who have lost everything that they ever had in some cases. We also must remember that the shelter is in a school, and so those children are currently, or a lot of those children are currently not going to school. So the community does need to come together and support the families and support moving forward. I would also like to say that the community can assist the Ministry of Health also in making sure drains are kept unblocked, not with the trash issue, with making sure that water, when it comes in these troughs, can go down the drains, can use to try and avoid some of the flooding issues that occurred.
Paho continues to give St. Vincent and the Grenadines, particularly through the Ministry of Health, significant support, and following this trough system, Paho responded immediately, and as a result you are here on the ground, doing going to the cemeteries, visiting Smart Hospital, making sure that things are repaired if there's a greater need for persons to be in that situation. Why do you guys see this as so, don't rush to answer at once, but why do you guys see this as so important to give this immediate support and this response?
I would hope that if the ministry asked for support under whatever circumstance, we would respond in a timely manner. When it is such a manner as the flooding and the issue with the cemeteries and the leaking in the some of the clinics, the need to respond is that much quicker. This is a disaster in the broader sense of the word, and we try and respond and support the ministry in whatever way we can. And the need at this time was a need for a very immediate response.
Okay.
Yeah. And the Pan American Health Organization, as the oldest public health agency, always try to respond within a given period because we have the technical expertise on the ground, and we always respond to whatever, whether it's health systems, whether it's issues as it relates to other public health problems. We are always there, and we are always happy to respond in a timely manner, which we did.
Are there any recommendations that you have for us, whether to the ministry itself or to the community?
For the ministry, in addition to what I've already talked about, and is the need for them to have greater community engagement and provide this psychosocial support that's needed at community level. For the community, I think one of the recommendations also is the need to look to the future and also be aware of what might come, which is the vector issue and mosquito breeding, and so to be sure to be not storing water unsafely and making sure that there aren't rodent issues, so for lepto, because these are all issues that can come about after flooding if you don't treat them well.
As we wrap up this interview, we want to, it's important that we use it as a learning curve in whatever situation we are, and to explain to persons that climate change is real and it is happening and it is affecting us in so many different ways. The TROUGH system is a testament of that, or an example of it. The recent earthquake that we felt is evidence of that, and you just spoke to us about preparing ourselves and looking ahead so that we can, do the part that we must do in the process of helping technical persons like you and the local environmental team to get their work done in a successful manner. Now, climate change, global warming, do you want to just talk to us a little bit about that?
Well, the climate change projections, as per the International Panel on Climate Change's Fourth Assessment Report, do talk about more intense storms that will happen in the Caribbean, and I think that it could be seen that this is what is occurring because the amount of rainfall that fell in a short space of time could be seen to be part of that long-term trend that is projected. I know that there have been other teams on the ground looking at water issues and drainage issues, and I think this is something, as we look forward, that we could expect to see more often.
Okay, so recommendation in that regard?
I think generally speaking, we need to pay attention to our environment, build appropriately for the environment that we live in, and taking a look a little bit to the future. So don't only build for today's weather, but what might happen in the future, which is in part what some of the smart hospital looks at, but also make sure that we build drainage systems that are able to deal with these trough systems, not only the normal rainfall that we experience, and that there's an integrated government approach with agriculture, planning, health, education all together to look at some of these issues, and forestry, as well, because it's a water catchment system is very big, and we need to look at the catchment as a whole, not just at one bit of the catchment, because it's all interconnected. Our environment is all interconnected.
Okay, thank you so much for taking the time out to do this interview with us. Are there any other recommendation or anything else that you want to say to us?
Not at this time.
Not at this time. Alright, thank you so much. It is my pleasure having you for this interview. We truly appreciate it, and come again.